Now what we're going to do is we're going to apply a radial wrist taping technique for de Quervain's tenosynovitis or any radial wrist pain. This is a particular technique that I like to use to keep it on the thumb better, and it's a thumb hole cut. So what you can do is measure your tape to length. Probably anywhere between a 25 to 50% tension. I fold one end over and about 4 centimeters up in the middle, you create a little thumb hole. So this is your first step. You'll do your rip in the center of that. Pull the tape away without touching the tape itself. Pull the paper away. I'm going to lay this over so it sits in this web space. I'll pull the distal segment down so it's in the palm, and then here I'll bring up and make a little fold right here, making sure there's no skin in that fold. Then I'll go ahead from this position out to the last 4 centimeters, and here's where it's up to you. Whatever the patient feels is best, you can either bring them into radial deviation and wrist extension, a little bit of thumb extension, tack it there, maybe put it on 25% tension, and then add a little overpressure to it, an ulnar deviation and wrist flexion, and lay that tape down. Now what I do is I come along here, snip that off. So this goes over the dorsal first compartment, and now what I'm going to do is apply my second piece of tape, either a decompression strip or a Y strip in through here. I'll do a decompression strip along the dorsal first compartment. And what I have is probably about an 8 to 10 centimeter I strip. I'll break this in the center. Then I'll go ahead and put, maybe I want 50% tension. I'll go to 50%, lay that down over the dorsal first compartment. No tension on my ends. And there I have a taping technique for de Quervain's tenosynovitis or radial wrist pain.